So the first part of my day is normally patient consults within the Pathways Virtual Clinic. And if you look behind me, you'll see it's pretty early. It's a little bit before 5 a.m. here in Switzerland, which is close to 1 p.m. on the east coast of Australia. And that's where all the patients that I manage are in Australia. I have a couple of minutes before my first patient locks in. So I did what we call an initial assessment for this patient, and that was done yesterday. And that's where we go through their intake form. And we already start to look at the gaps in care, what questions they might have, and any research we might need to do in advance for that patient. Pathways is a virtual clinic, so we have interventions and assessments and protocols that we follow. And these are all tested in a formal pilot to see what the scope of practice looked like for a virtual nurse clinic. So that's what the Pathways Clinic is today. So the patient has just logged in, so that's my cue to get to work. So it's 8 a.m. now, and I'm finished with consults for the day, and I'll spend some time now finishing up my clinical notes, as if I don't do them straight away, I get really behind, and I never catch up. So I'll need to do some follow-up for each of the patients, and that will be things like making some calls to confirm potential referrals to allied health are appropriate to make sure they're familiar with the rare diseases that the patient is presented with today. Another patient was post-discharge from urgent care, and their discharge plan was a little bit vague. So we went through the next steps for them, and I'll document that for them to take back to their primary care centre for follow-up. Also had a newly diagnosed patient. So that was mostly an education session for them. Their partner was there as well. And the last patient was someone that lives about 2 hours from the closest major hospital. So we walked through some shared care between local clinicians and specialists in the major hospitals in their close city, and I'll put some education together for them as well for their local clinicians because that patient had a rare disease. And once I'm finished that, I'll check up on the other Pathways nurses, and I do a daily check on the clinical data management system, and that's to make sure everyone's complying with protocols. Then I'll triage any new patients that have come in overnight, and then once that's done, I'm pretty sure I'll be ready for a coffee. It's about 10 a.m. and I'm just heading into it now after some patient consults. But first I've got a meeting here at WHO. This part of Geneva is where the UN is just down the road, ICRC as well. All the diplomatic missions are here too. It's a great place to have a global health NGO like CCDR. So we've made it to midday here in Geneva, and next on the list is this pile of CVs that I need to go through, and it's for a lead nurse role for CCDR in Sudan. So wherever we work, whatever we do, it's always led by the local professionals, local communities, and then my role as chief nurse is to provide that infrastructure and oversight for the nurses and researchers to be able to do their work. But it's really the local staff that lead the way, and a lot of the time I just need to sit back and listen. We've had about 60 applications for this role, and it'll be open for a few more weeks, but today I'm just going through this first tranche to keep on top of things. It's about 1:30 p.m. now, and I'm switching gears to do some work on one of our current PEAK studies. And PEAK stands for Personal Experience, Expectations and Knowledge. This is the research program where we listen to patients about their experience in the health system so that we have evidence for advocacy, and it also doubles as a repository or a community-led clinical registry. So what we're seeing here is our purpose-built database, and we do all of our qualitative coding and cross-validation between these data and the online questionnaire here. We have over 2,000 structured interviews, and that's using a single protocol across many disease types. So that's also useful because then we can run comparative analyses. The research team collects the online questionnaire data and conducts the interviews and does the transcripts. And at the end of an interview, patients are asked if they need any information or support. So now I'm going to check within the latest interviews to see if anyone needs to be referred into Pathways. And then what I'm doing this afternoon is reading through some of those transcripts, doing some coding of the themes. And even though I have the job of chief nurse and CEO, This and managing patients through pathways is something that I really like to do, and it's really important to me to stay connected to the experience of patients. My afternoon's been pretty busy. It's about 5:30 p.m. here, and I'm just back home, but still have a bit of work to do. I just finished up a planning session for a conference we have coming up in July for the National Patient Organisation Network, which really focuses on sustainability for patient organisations that play such an important role in health systems. After the planning session, I did monthly accounts and payrolls. Not that interesting, but all part of the job. And the last thing I'll do today is some prep for tomorrow morning's patient list. Got a few patients tomorrow that haven't found a diagnosis, and that can be quite tricky, going through all the differentials to determine what they might need to access next. Some days I'm out of the office or traveling to sites or in meetings, but today was a bit of a mix, and I love that within a day I can be talking to patients in the clinic, reading about their experience in their interviews, working with community groups, but then have meetings at national and global levels here in Geneva. Really gives you a great perspective on the health system when you can work at all those different levels, and that's a day in the life at CCDR.